South Dakota became the first state where it was completely a statewide guideline for STEMI heart attack patients. No other state went border to border doing the same guidelines, same protocols. And one of the other key areas of that grant was we provided 12 lead EKGs machines that remote transmit to hospitals and cardiologists too, that the paramedic and EMTs can dial in who they want, which hospital they want it to go to, and they'll take the EKG reading of the heart and send it to the emergency room, and the physicians at the emergency rooms can determine what kind of heart attack the patient's having. And that's not only just a cool function to have an instant diagnosis going on there, but it helps speed up treatment. Many ways. If a patient is having this type of STEMI heart attack, they can divert to a more appropriate hospital where they can get the patient into a cath lab, or if they need an air ambulance or a helicopter evac, they can start ordering those type of things. So it gets the patient quicker to those cath labs. And getting a patient to the cath lab is key for survival and key for better long-term outcomes, because the quicker they can open up that artery that's clogged and restore blood flow to the heart, the less damage you'll have. And with less damage, there'll be quicker rehab, the outcomes will be better. There's just so much where it's key to that. And what was really interesting, we saw improvement over STEMI survival over 4 years of that grant. It's still improving.
From about 7.2% mortality for our STEMI patients to below, and our national average was about 6.3, 6.5%. So we were worse. And by the time the grant project was done, we were sitting at about 4% mortality. So we were significantly better than national average. And that's dedicated to, everybody from EMS, 911, the local hospitals and those receiving centers all saying, okay, yep, we're going to get this protocol right. We're going to get past a hospital that can't take care of a patient. We're going to shave minutes off. And the testament to that is that our numbers from first medical contact, like so when EMS arrives, to getting somebody to the PCI center dropped significantly down to about 77 minutes. And that the American Heart Association recommends within 90 minutes.